Okay, can you describe the scene, like what you are seeing on the front lines in the ICU?
I mean, locally, if you and I were speaking a week ago, I'd say that I have one patient in my ICU with COVID-19 on a ventilator. And today we have 10. I only have 17 beds, and 16 of them are full right now. So that's the situation at my hospital. But in general, in the greater Toronto area, which is the area hardest hit by COVID-19, most hospitals are approaching capacity. When I say capacity, I mean staffed beds in the ICU. There may be physical beds, but there aren't people to take care of them, which is why last week, Todd, 34 patients with COVID-19 who were intubated were sent from GTA hospitals to other hospitals as far as Kingston.
Right, so the patient transfers as well. Maybe if you can just explain how potentially dangerous even that can be.
Well, the truth is we do transport patients all the time throughout the system pre-COVID because some hospitals have resources that others don't. 34 patients in 1 week because of capacity issues is something that's unprecedented. You always put a patient in jeopardy when you put them in an ambulance. The paramedics are highly trained and there haven't been any adverse events, but we also have to acknowledge that there are patients with other needs that need to be transported as well. And there are only so many critical care transports in the province. And eventually, my concern is that within the region, everyone's cup will runneth over and there won't be really anywhere to send patients to. Ottawa is too far, Sudbury is too far, Thunder Bay is definitely too far to send critically ill patients.
I also saw this really quite astonishing number just for Ontario, Dr. Warner, where something like 250,000 procedures, surgeries delayed, postponed as a result of what's happening, and sort of the impact that that has. We often forget about that because we're so focused on the pandemic, but the sort of collateral damage.
Todd, I think about that a lot. The delayed and deferred non-COVID related care. Every day, surgeries are canceled. On the best days, most hospitals in the hot zone regions are working at 50 to 80% capacity with respect to surgical output. Those cases add up. Those needs don't go away. So there's a tsunami of non-COVID related care that's coming for us after COVID-19. And I haven't heard a plan from the government about how to deal with that. I mean, right now we can't because we have to see what's right in front of us, which is a massive wave 3, but we cannot forget about those patients who have non-COVID related illness.
I know that you have been very outspoken and you have been trying to get the attention of the provincial government, and I know it hasn't always been successful, of course. We did hear from the Premier today, Doug Ford, in which he specifically mentioned you, Dr. Warner, and I just want to play a little bit of that news conference so people at home can get a sense of what Doug Ford had to say about you specifically.
I understand, Dr. Warner, I think he's a great doctor. I know he's always commenting every single day, but I listen to Dr. Williams and a whole other team of doctors that give me advice.
So he references Dr. Williams, who is, of course, the top doctor in Ontario and the one that he gets his advice from, he says. Just your initial reaction to what he just had to say.
So I think it's important that the Premier leverage the expertise of all the physicians he has at his disposal. I mean, Doug Ford and I, the Premier, we text from time to time, and he and I have spoken, and I think that's great that he's open to that type of feedback. But if there are people on the outside, let's bring them on the inside. I mean, the more brains, the better. And the ICU doctors and other frontline workers, we're the canaries in the coal mine. We see what's happening. We're the ones who see the racialized, marginalized people getting nailed by this. We saw it in wave 1, we saw it in wave 2, we're seeing it in wave 3. We're the ones who see the essential workers who don't have benefits getting infected and dying. We can help. We want to help. This isn't political for doctors. This is about saving lives. So I actually think the Chief Medical Officer of Health, that's who he's relying on. He needs some help because him and his team have led us to where we are today. And this is not a good place. And I don't actually know who's on the team with the Chief Medical Officer because they've never been named.
What's your advice when it comes to lockdowns, Dr. Warner, or other measures you think that Ontario, perhaps other provinces, should be taking in the here and now as we sort of have this race between the vaccines on one side and the variants on the other?
So to be clear, the variants have won, especially in the hot zone regions. Every single one of my patients has the variant. Almost all their family members have it too. This is a different pandemic with the variant. And the politicians have to decide about lockdowns, but they actually have to decide. They're the ones who have control over this situation, not the doctors or pundits. It's the government who holds the keys to stopping this, or at least slowing it down. So right now, anyone who can stay at home should stay at home, talking specifically about where I live in my region. And we're not gonna be able to vaccinate ourselves out of this because of supply issues and distribution issues. We simply don't have enough. we've got 2 to 3 months of hard work. That means public health measures, supporting people, protecting people, making sure the people at the highest risk for exposure get the vaccines that are available. It's not the time to open up because the hospitals are imperiled right now, and the government actually is in control, but they can't keep deferring the decision they're going to have to make.
And what about the situation in schools? Do you think that spring break should be going ahead?
I'm not going to weigh into that because it's not my area of expertise. I have 3 young children in school. I think kids really benefit from being in school. We don't know whether schools are safe, though, because we haven't tested adequately. Teachers don't have appropriate protection. So we want schools to be safe, and we know kids are unlikely to get sick, but we don't know the impact of schools on amplifying COVID in the community because we don't have the data to prove that it does or doesn't happen.
And I know we're seeing younger people being admitted to hospital as well. Maybe I can ask you about the potential risk there and what you're seeing.
I've shared some stories with permission on social media about my patients in their 30s, in their 40s, who are right now in my ICU, on their bellies, prone, breathing through a machine, paralyzed, barely holding on right now. And this can take down younger people for sure. And the people who are being infected right now are people who would not meet the criteria to be vaccinated in our province because either they're not old enough or they're not in the right category. And these are people who drive for rideshare companies, work at checkout counters at stores, work in factories and warehouses. These are not people partying. These are people who can't be protected from COVID-19 because their exposure risk is simply too high based on the nature of the work they do.
Dr. Warner, I appreciate you taking time. Good to have an extended chat today. Thank you. I know it's busy.
Thanks, Todd. Take care.
Dr. Michael Warner, an ICU physician at Michael Garron Hospital in Toronto.